All set?
All right, good morning, everybody. Welcome to the first 2026 meeting of the Workforce Diversity and Inclusion Advisory Committee. We have 4 members online, 5 members in chambers, 1 member on her way to chambers, and in any case, that is quorum, so we'll call this meeting to order. First off, welcome everybody. We have some new faces here. I have been told that I tend to spend too long doing introductions, but I would like to do some today because there are new people, although I don't know. Whatever, we can just do them. I don't know if it makes sense to wait for other Rachel.
Oh, okay.
Let's just go ahead. Could we, goodness, could everyone please just introduce yourself? Name, pronouns if you want, your whatever role that links you to WDIC, and optionally 1 sentence at the very max of why you joined the committee. I will start. I'm Veronica Pillar, pronouns they, them. I am a legislator at the beginning of my 2nd term, chair of this committee, and excited that we have almost full membership. And I'll pass it to Irene.
Great. Hi, I'm Irene Weiser, one of the new members of this committee. I'm a county legislator. I go either she or they pronouns. And I wanted to be part of this committee because without diversity and inclusion, there isn't democracy.
Hello, Rachel Graham, pronouns she, her. I am Deputy County Clerk for the County Clerk's Office, and I joined WDIC, I think, in 2019 because they were recruiting workforce members, and I care about what we do here.
All right, I'm Samantha Almendinger. I am the county's training and development coordinator. I work in HR. My pronouns are she, her, and I joined, I'm also a workforce member and kind of a rep of HR, and I think the work that this committee does is very important.
Good morning. I'm Iris Packman, one of the new legislators. I'm excited to be on this committee. I've been passionate about issues of workforce diversity, equity, pretty much since I was a teenager, and I've been working in the world of work, as in labor issues and labor movement and labor policy. So I'm excited to hear from you all about what you feel is working well and where there's room for strengthening things.
Thank you. Let's go to Zoom. There's no inherent order, so please call on someone else when you are done. Let's start with John.
Good morning, everybody. John Halachik, Assistant Director of 911 for the County Department of Emergency Response. My pronouns are he, him. Full disclosure, as it comes up sometimes in this committee, I also serve on the board of directors for suicide prevention and crisis services in the county. And I also am appointee to the state surrogate decision-making committee for end-of-life decisions for those that are unable to make those decisions. The reason why I joined this committee, multiple reasons. One, very passionate about the mission of WDIC, whether it be labor policy or generally what we do discuss from month to month in the committee, and also as being a member of the LGBTQ committee, so that diversity, equity, and inclusion piece really does hit home with me. Passing it on to Jennifer.
Hi, everybody. There's my camera. Jen Micah, I am a community member, she, her pronouns. I work at Cornell and I serve as the Director of Diversity Inclusion in the S.C. Johnson College of Business. I have been involved in DEI work in Tompkins County for well over a decade. And when I was asked to be on this committee, I was excited because I want to continue my work in the community and just learn more about what's happening in Tompkins County. And I'll pass it over to Nick.
Hello, good morning. My name is Nick Bennett. My pronouns are he, him. I'm a professor at Ithaca College, assistant professor. I worked as a communication specialist with the county for about a year and a half, and I looked at my LinkedIn to see that I've been in WDIC, that's how I keep track of things, WDIC since 2022, so that's exciting. So I'm a community member at this point, and I can't think of anything very articulate to share with why I'm part of this committee, but I feel very strongly about the work that we do, and I will pass it over to Robert.
Morning, everybody. Happy to see you all. I'm Rob Brown, a community member appointee residing in the town of Lansing and also finance director for county affiliate Cooperative Extension of Tompkins County. My pronouns are he, she, and they, mix and match, as you please. And I've been on WDIC since the late 20-teens. I forget exactly when, but after 20 some odd years of lobbying the county legislature about human rights and labor rights, Leslie Bean Claiborne put a pre-filled application to this committee in my hand and told me to sign it.
Thank you. And now, other Rachel has arrived. Do you want to introduce yourself? You've probably got the pattern.
Yeah. I'm Rachel Osland. I she, her pronouns, and I'm new and excited to be here.
Yeah. Awesome. Thank you. Chris, you're not a member of the committee yet, but will be soon, pending normal procedures. Do you want to introduce yourself?
Yeah, so hi, I'm Christopher Spahn. I'm the Executive Director of Tompkins County Workforce Development. I will be joining the committee next month, so excited to be here. I've been with the county for over 3.5 years, so during that time I've been with the JEDI group, so Justice, Equity, Diversity, Inclusion. It's a employer-run group that focuses on equity and inclusion. So I'm excited to continue that work into this group. In my outside life, I'm on the Southside board, and then the Diversity Consortium of Tompkins County board. So I think all of this work is very important, and I'm ready to integrate it into all of our lives and connecting with everybody here too. So thanks for having me.
Awesome. Thank you for joining us. And Jordan, do you want to introduce yourself? Also not a member, but keeps this committee running.
Yes, I am Jordan Cree. I am your staff individual, and I also hold the records for all advisory boards or advisory committees. And so happy to see that after Chris's adoption next month, we will only have one undesignated seat. So if anybody has any idea, let me know, and we can get them filed.
Yes, amazing. Thank you all. So with that, changes to the agenda. Are there any changes to the agenda? Seeing none, that's great. Chair's report. I don't have a report per se, but we have one item under here is we need to elect a vice chair for this year. As a sort of hybrid legislature committee advisory board, the leadership is also chosen in a hybrid way. The chair of the legislature appoints the chair of the committee, which is me for this year, and then we, the committee members, elect a vice chair. So do we have to, Jordan, do we have to vote to like open nominations and all that? Okay. Would somebody like to move to open the floor for nominations for vice chair? Irene moves, Rachel Ostland seconds. Would anybody like to make a nomination for vice chair? And I can make a nomination, right? Okay. I would like to nominate Iris for vice chair. Because, yeah, and hopefully, well, my personal, a personal goal I have is that I have been, this is going to be my 4th year chairing this committee, and it is time, I think, for someone else to do it next. I'm the only, as the bylaws say, the chair has to be a legislator, and I am the only member who is both a legislator and returning, but I would love someone else to be vice chair this year, hopefully with the intent of chairing it in the future, should they not be completely turned off. And I think Iris would be a wonderful choice.
I would second.
Okay. All right, Rachel Graham seconds. Discussion, do we do that? Or?
Yeah, I just have a question as to whether it could be staff members as well, or only, it could be.
It could be. The vice chair can be any committee member. And Rachel G, what do I call you too? We'll figure it out. Yeah, Rachel Graham has been vice chair in the past.
Yeah.
I guess,
Closing.
are there any other nominations? All right, may I have a motion to close nominations for vice chair? Rachel O moves, Sam seconds. Did we even vote on opening nominations?
We did. No. And you have to do a roll call. Would you like me to do it for you?
Yes, please.
Fair. All right, I'm going to start with those online.
Wait, so are we retroactively voting to open nominations, or what are we? Okay, all right.
Jen Micah?
Are we just doing roll call now? Or are we voting?
We're backing up a step because I messed up, and we are voting to open the floor for nominations for vice chair.
Yes, yes.
Robert Brown?
That'll be a yes.
Rachel Graham?
Yes.
John Helichek?
Yes.
Chris is not a member yet. Samantha Almendinger?
Yes.
Iris Packman?
Yes.
Nicholas Bennett?
Yes.
Irene Weiser?
Yes.
Rachel Ostland?
Yes. And I'm a yes.
Veronica Pillar?
Okay. Okay, fantastic. Do we need to do the nominating again? Okay, great.
So I have, it was moved by Rachel O. and seconded by Samantha to close.
Great. Let's vote on closing nominations. Can you lead it again? Yeah.
Robert Brown?
I'm a yes.
Jen Micah?
Yes.
Rachel Graham?
Yes.
John Helichek?
Yes.
Veronica Pillar?
Yes.
Samantha Almendinger?
Yes.
Iris Packman?
Yes.
Nicholas Bennett?
Yes.
Irene Weiser?
Yes.
Rachel Ostland?
Yes.
Okay, fantastic. Nominations are closed, and now we vote on the vice chair. There's been one nominee, so are we just doing is the motion to elect Iris Packman as vice chair of this committee?
Yes.
And you can vote yes or no, and I guess we always need a roll call, so Jordan, can you call it again?
Sorry. It's the hybrid online. Robert Brown?
Yes again.
Jennifer Micah?
Yes.
Rachel Graham,
Yes.
John Helichek,
Yes.
Veronica Pillar,
Yes.
Samantha Allmendinger,
Yes.
Iris Packman,
Yes.
Nicholas Bennett,
Yes.
Irene Weiser,
Yes.
Rachel Osland.
Yes.
That is unanimous. Congratulations, Iris, and thank you. All right, that is all I had for Chair's report. Moving on to minutes approval for the meeting of December 18th, 2025. Would someone move the minutes? Rachel Graham moves, Iris seconds. Any discussion or corrections? Seeing none, can we have a roll call vote for this?
Robert Brown,
Yes.
Jennifer Micah,
Yes.
Rachel Graham,
Yes.
John Helichek,
Yes.
Veronica Pillar,
Yes.
Samantha Allmendinger,
Yes.
Iris Packman,
Yes.
Nicholas Bennett,
Yes.
Irene Weiser,
Yes.
Rachel Osland.
Yes.
All right, that is unanimous. Thank you. Moving on to reports and updates. This is a standing section of our agenda. First, report and update from the Chief Equity and Diversity Officer, which we do not have at the moment, so we will not be having a report from them. I have an update that I think I'm allowed to share this much, that the hiring process is almost over. A candidate has been offered the position and has accepted pending legislature approval. And so this will be, assuming nothing strange happens, a voting item on the March, whatever it is, March 3rd meeting. And I don't know what the person's start date would be, but hopefully soon after that. I guess, any questions about the Chief Equity and Diversity Officer? Not for them, those will have to wait. Bab.
Who was on the selection committee from this?
So there was the original, the main selection committee was like several people, including me and legislator Travis Brooks and a handful of staff members that I don't know. Can I say who? Does
That's okay.
any?
It's okay.
Okay. But yeah, it was like several other staff in leadership roles that all in some way or another are going to interact a lot with the person in that position. But then the final decision was made, that committee, we reviewed and interviewed and ended up recommending 2 candidates for a final interview conversation with the county administrator. And so Corsa and I think anyone else he invited did that and made their selection. Yeah. Other questions? All right, Team Jedi, Justice, Equity, Diversity, and Inclusion update. And I suspect this may roll into our next item, but yes. Rachel, Jedi co-chair?
Yes. So JEDI did not meet in February, but as we look ahead, we're hoping to revisit our meeting structure for 2026 in order to engage more members and improve attendance. So we'd like to identify a consistent meeting day and time that works better across departments, but we have not finalized dates because we are waiting to coordinate with the incoming Chief Equity and Diversity Officer. So once we know who that is and can make contact with them, we'll figure out what our meeting times will be going forward. In the meantime, we've discussed some engagement ideas that could complement our regular meetings. So we've discussed some ideas around workforce reading and discussions groups and alignment with the upcoming workplace climate survey so that JEDI's work supports and responds to what we learned from staff feedback. Separately, the parental leave working group continues to meet and has been drafting both a policy and a resolution. And the intention is to collaborate closely with HR, county admin, union leadership, county attorney's office, and potentially the incoming CEDO and the legislature as we refine the proposal. And the goal remains to move forward in a way that's inclusive, collaborative, and well coordinated across stakeholders. That's my update.
Awesome. Thank you. Any questions for Rachel? Iris.
Yeah, thanks for that. Just coming in new, so apologies, others have already addressed this, I imagine, in previous years, but I'm curious with regard to the parental leave policy, since it is a change in a term and condition of employment, how is that going to be slotted in with the union contracts at this point? We discussed that?
Yeah, so my understanding is that if it's a policy, then it's just a county policy, so it just rolls into whatever contracts exist for employees.
And none of the contracts have any parental leave at this point?
Not that I'm aware of. I don't think so. Oh, Matt's saying maybe.
The white collar has a parental leave.
Oh, sorry. Do you want to come up to the, Matt, right?
Yes.
Yes.
Sorry, hi, Matt Phillips. The white collar does have a parental leave policy. It's 6 months of unpaid leave. It's just a leave of absence. So that's the only thing that's written in the contract right now.
Other questions? John.
Yes. When we were talking about this in the last committee cycle, at probably July or somewhere thereabouts last year, there was discussion about how this was going to be funded, and there was some discussion about that there was going to likely be a contribution on the part of all employees in the county to underpin this. That concept was also referenced in the survey that went out following that WDIC meeting, but there really hasn't been a follow-up. And can someone speak to that to kind of clarify, because that really ties into the contractual question that was just asked, and something that would help me sort things out in my mind.
Yeah, so we're talking about two separate things now. New York State family leave, which Tompkins County opts out of. And so we did explore what it would look like should Tompkins County opt in. There is a carve out in the law for public employers, and Tompkins County, since that started, I think in 2017, has opted out and continues to opt out. So that's the one that would be employee contribution from paychecks, and that provides 67% of your pay when you take leave. That you qualify for under that leave. So that is not what we're talking about now. Now we're talking about parental leave for county employees. That would be a policy, and that would just come from salaries that are budgeted, because all the salaries are in the budget.
Rob, Rachel, I see your hands. Is this also about parental leave?
Yes, it is.
Yes? Okay. Why don't we get that resolution on the floor? Because I think all of this discussion is appropriate to the scope of that. Could I have a mover, perhaps, for resolution number, it doesn't have a number, right, adoption of paid parental leave policy for Tompkins County employees, ID number 13889. Iris moves. Rachel Ostland seconds. And now we're back into the same discussion. So Rob, then Rachel Ostland, Yes, Robert.
Okay. So just general remarks. When we initially got New York State paid family leave through, I was disappointed, among many others, that the way we ended up implementing it statewide was as a rider to disability insurance, which short-term disability, which exempts public employers, and hence paid family leave also has the same exemption. So public employees in opt-out workplaces like Tompkins don't benefit from maternity, from short-term disability, or the paid family leave benefits, either for parental needs or other healthcare needs of family members. So moving forward with something that does provide these benefits while we remain opt-out for the insurances that private employers have to carry, I think is an imperative thing. And of course, getting a county policy baseline in place that can then be a reference point for collective bargaining when contracts come back up again, I think will make the bargaining process stronger and clearer. So in the broadest sense, I support a resolution for implementing this policy and hope that as it goes through a county admin, budget, and so forth, we can all remain resolute in making it as generous as practicable.
Thank you. Rachel, and then John.
I had two questions. I guess the first one is whether this kind of speaks to the New York State paid family leave. If there had initially been a discussion of making this policy more similar to the paid family leave, just in its scope of including people who might be caring for a sick family member in addition to the, I mean, I'm in support of the parental leave policy, but I wasn't sure if there was a plan to maybe have a separate policy to address people who might be taking care of a family member, something like that. That's my first question.
So personally, I would love to see a separate policy that addresses that. But I think we started the working group to focus on parental leave. And then we kind of went down the rabbit hole of New York State family leave. And then I started realizing all those other situations that aren't covered, including for myself personally. I'm not married, but my partner is on my insurance, and should something happen to him, I'd be out of luck there. So if I needed to care for him. So yeah, we purposefully kept it separate because we really wanted to focus on parental leave first. And so that's why we are where we are now.
And then my other question was about whether if we're talking about the policy itself, because we're not actually recommending that we're adopting, that the legislature adopt kind of effective immediately the policy, right? We're just saying that we want the legislature to approve kind of the direction that this will then go to admin and HR.
Right. I think that is the intention. And so we may need to change the wording of the resolution. Yeah. John, and then Iris.
So a couple of things. To the comments that Rachel just made, Rachel Osland, I wholeheartedly agree with the statement that she just made. And specifically regarding those other situations, such as a catastrophic health incident of another family member, and so on and so forth. And although I do support the concept here of paid parental leave, and I just want to make that very clear to everyone that I am not opposed to that, I'm wondering if the county and subsequently its employees are better served with a comprehensive policy rather than carving out each particular circumstance of paid parental leave and renaming it something else, that paid parental leave, catastrophic leave, etc., would all fall under and benefit from whatever this specified term of fully paid leave would be. rather than having to come back and in each unique circumstance go through this process. That's my first question, or my first point. The second thing is, as we discuss the resolution before us, I'm wondering, should this be done in executive session because underpinning the resolution is the draft policy, and because it is a draft and not finalized, is that more prudent? And I'm looking for guidance from you all as far as how best to do that.
Thanks. I can field that. I don't think that this is, this falls under the criteria for executive session. Details of like labor contract negotiations are an executive session topic, but that is not the stage that we are at.
So as we continue the discussion on the resolution, we can refer to that draft policy without issue, because I can see easily where one is going to link to the other as we discuss this today.
Let me look at our clerks.
I do not have anything under the public officers law that would make it so we wouldn't have to go into executive session for this. When it comes to the labor unions, nothing has been decided. We're not negotiating with the labor union right now. We're just discussing our ideals and what we would like to be put into the policy. I don't believe that would interfere with the law.
Right, that makes sense. Thank you.
Thank you. I have nothing else at this time. Thank you.
And I guess I would throw in, this committee does not have the power to directly affect labor contracts, to my knowledge. So our discussions here are safe on that end. Iris.
Yeah, I agree with both John and Rachel, and I guess Rachel O is who I was thinking of. But in discussing sort of the idea of maybe expanding this to be more of a family leave policy rather than parental specifically, because as you said, there's a whole range of caregiver scenarios that impact folks of many different age ranges, and it doesn't feel fully inclusive to focus just on those in the parental situation, although it is very important. As someone who had to scrap and grab for any days I could when I had my kids, and my first kid, I was in the hospital for 5 days, and that was the amount of leave my husband had, was 5 days. We got home, had a newborn out of the NICU, and that was it. I had to figure it all out on my own. So I get it, and I think it's really important. But I think let's be as inclusive and expansive as possible. Also, to the question about the unions, I was just looking on the New York State paid family leave law. There's a section on their website around public employers, and it does say specifically a public employer may not opt in for employees represented by a union without collectively bargaining with the union to provide paid family leave, which is what I was kind of asking about earlier. So I think what we can talk about is the policy that would apply to those not covered by the union, but then there would presumably in the future have to be some negotiation that would occur for those covered by the union, various union contracts. So just to frame that as well. Also, when we think about cost, and we got some comments from staff in our emails. I hope most folks have seen those. They were great. Really appreciate people speaking up, and I think it would be great to make sure more folks are aware of this issue, and if they want to also contribute comments. But I think it is helpful to reframe and think about the cost of this. It is, as Rachel G. said, it is coming out of existing already budgeted salary or wages, right? These are not, this is not an additional payment to existing employees. However, there could be costs if there are, folks brought in to help cover the gap time. But I think that can be helpful to reframe. It's not that we're paying people an extra 3 months of salary, for example, or wages. So hopefully the cost would be somewhat, not as much as we maybe imagine when we first think of it. So just to keep that in mind. So I would propose, if folks are open to it, maybe amending what we're looking at as a full caregiver policy rather than just parental leave, and obviously there would be subsections, but that way we're not parsing out, you know, which family members qualify for you to have this kind of leave and which ones do not.
Are you proposing an amendment in the Roberts Rules sense, or are you just offering a suggestion for further discussion?
I think I'm first offering a discussion, but then certainly if it seems friendly, then we could move to amend or replace the resolution.
All right, fabulous. Irene.
I too support this idea in principle. I do wonder about a practicality, which is just related to how long did it take to generate this policy? How long is it going to take to modify? And whether we could, you know, maybe it's more practical to move this forward while we start working on broader coverage, just knowing that sometimes government process can take a really long time, and at least get something in place for something, rather than putting it all on hold.
I'm going to take a turn first, if that's okay. Could maybe the folks who have been on the paid parental leave working group, which I think is Rachel G. and Matt, and no one else here, could you give a little overview of the process to that point? I know you have updated us on various WDIC meetings, but of course there's new folks here, and a summary might be helpful, especially if there's stuff we're bringing up that you've already considered.
So yeah, I think it first came up July of 2025. Does that?
I got asked to join the group in April.
April?
So I think June, April or May was.
Oh, okay. So it was spring of 2025. Well, I guess it was whenever, and we can look that up, when Ulster County adopted their paid parental leave. An employee reached out to the former CEDO and myself about that, and then we immediately put the working group together. We started doing our research then, looking into what the state offers, what federal employees offer, what Cornell offers, other local employers, and then we put the survey out to employees in August.
In June.
Really? In June.
In the summer.
Yes. And then shortly after that, we were told that HR was looking into possibly opting into New York State paid family leave. And then, so we were told to pause. So then it was a few months of nothing. And then eventually we reached back out to find out, should we get back to work, what's going on? And we were told the county is not opting in. There was, I think thought they were looking into employees being able to opt out if they wanted to, but it's an all or nothing situation. Either all employees are paying into it or the county is not opting in. So at that point, which was, when did we pick back up?
October, November.
Okay. So then October, November, we said, all right, let's pick up where we left off. And then that's when we started drafting the policy.
So it was all relatively quick. That was a joke, you guys.
Yeah, yeah. So, and that would be my only hesitation to expanding it, is that I would be afraid it would slow it down a lot.
Thank you. Rachel O.
Yeah, I certainly wouldn't want it to go back to like the drawing board. I mean, I would say to expand it, if it was possible, to kind of take all of the work that's already gone into it and just say that in addition, like whatever has already been worked out, in addition to people who have recently given birth or have recently adopted a child, that you could also qualify if you met these other kind of family leave things. So in a way that we would kind of add it in if it really felt like it could kind of keep the momentum that you already had built going.
Yeah.
Yeah, Iris. Yeah, I'm just looking through the draft policy, which as someone who's written employment policies in the past, I don't think it would be a heavy lift to just add a little more definitions, right? You're just expanding it's for the birth of or adoption or, care of a child or, a family member with a serious health condition. And then we just pull language from existing state and or federal definitions. So hopefully it wouldn't be too much of a change from that perspective. I don't know if the policy, the idea of it, if you think that might be part of the delay, that like it'll be harder to get enough votes, for example, to get it to pass if it's not just about parental leave, but it's also caregiver leave, for an elderly family member or, a spouse or someone or, a child with a health condition or something like that. If you think that would be part of the concern about the delay.
I would hope not. And if so, I guess we can cross that bridge when we get to it.
I have a comment and then Rob. I would guess that at least like among legislators looking for ideal policy that there would be like, how to phrase, that there would be little to none of the opinion of I support parental leave for people caring for a child or only a newborn child, but I don't support caregiver leave. I don't think that will be a big thing. I am curious what, I think the like worries and hangups are more about the process of adopting this and the like, are the finances and the legality all in order? And I think I'm underinformed on what like is the method for establishing parental leave or like caregiver leave in general harder in some qualitative way than for parental leave. Like, for instance, I guess I'm actually not clear here if this is, if the policy depends on us not opting into the state paid family leave or paid parental leave or, sorry, I'm mixing up phrases. Like, are there existing examples and definitions of parental only leave that would be easier to implement than if we just called it caregiver leave? I don't know if this makes sense. Like, is there anything that like, is there any added difficulty in expanding it to caregivers, not just parents, beyond it would be probably more total people taking more total days of leave?
Yeah, I think it's just more inclusive of all kinds of caregiver situations that employees would be facing.
Just to explain, I think for the state opt-in piece, what that is that there's a payroll deduction that comes out of people's paychecks, right? So that if we opted in, all the county employees would then start having this deducted from their pay. It would go into an account that the state administers. And then when people want to take that leave, they apply to the state and they get that 2/3 of their wages back, right? So in a way, it takes some of the financial burden off of the county by shifting it to this pool that the state is administering. It does mean then that there's some deduction from employees. So that could be part of what we do in recommending is that we recommend that we opt in, right? And choosing to do that in order to help pay for this. And that fund covers more than just parental leave. That's the family leave, as I understand it.
Get Robert first.
Yeah, okay, Rob, and then Rachel G, and then Sam.
So, as I'm sure my remarks earlier made, I am supportive of as broad caregiver or healthcare leave process as possible. I should think that it would be straightforward enough for us in our resolution to encourage that the scope of this policy be as broad as is reasonable. I also share concerns about dragging it on further and expanding the scope of it as an internal policy, not having a relationship to things like the disability insurance, paid family leave insurance pool, does mean that we would be inviting wider exposure to financial burdens from the other circumstances. And just considering my line of work, I can assure you that even when a staff person is already budgeted, a broader leave policy is not budget neutral. It does hit more because the work has to be covered, and the strain on people who are filling in also has to be considered so that folks maintain a healthy work-life balance to the extent we can encourage it. So that is a concern, but I would certainly include in our resolution that we hope that BCP and legal will move towards as strong and as broad a family care policy as possible, with the understanding that if we're going to get ourselves dragged down on other forms, I'd rather that we see a parental leave policy than none at all for another year. And looking at whether to opt into the state pool is something that we should certainly do. I was disappointed that we haven't thus far. Another option that we would have financially is to create a self-funded pool, which would nonetheless have to involve bargaining about payroll withholdings and require building up a balance of our own before we could start reasonably covering leave, as opposed to jumping into the public insurance pool where we would be, along with other employers in the state of New York, covering it rather than trying to manage an internal fund. So as far as an internal funding mechanism, that seems far less preferable than simply going in with the rest of New York.
Thank you. Rachel.
Yeah, I just want to share that we did bring in union leadership into our discussion with the working group at one point. There were 3 leaders from the white collar union that shared if we were trying to advocate for the New York State paid leave for the county to opt in, that it would be really hard for them to support that because they don't want to see any more money coming out of employees' paychecks. They've expressed concerns of employees already saying that it's difficult paying their union dues, so they couldn't advocate to be pushing for that, but that if we were working on the parental leave policy that didn't take any money from employees per paycheck, that they would fully support that. So for whatever that's worth, just wanted to share.
Thank you. Sam.
Yeah, I was going to speak to what Rachel just said, that opting in, from my understanding, would require union approval. So from all of the unions. Yeah.
This is opting into the
paid family leave.
The state.
Through the
paid
state,
family.
yeah.
Irene.
Do we know what it would cost if we didn't pull the money out of paychecks and just pulled it out of county budget somewhere?
I don't.
I'll just hop in and say that standard PFL, there's always the option for an employer to opt to cover the withholding amounts. So that would certainly be something worth looking into. Every employer whose PFL policy I've contributed to has opted to cover the employee portion of paid family leave withholding.
So there is a way. So it is a theoretical option for the county to opt into the state program and also have, not have county employees' paychecks additionally deducted from that would just, cost more money to the county. Is that what you're saying?
Yes, that is how it works. It's a withholding of 0.432% of an employee's gross wages up to an annual cap, which by the default in the law is covered by withholding from paycheck, but can be covered by employers.
Okay, thank you. Iris?
I was going to give that number to put it in perspective. Someone who makes $2,000 per pay period, which would be about $48,000 a year, that's $8.64 per pay period, or it's a little over $17 a month. If that gives us a sense of what we're talking about here.
Thank you. John? You are muted.
Yep. So a couple of things. So I would be very hesitant to explore a state option as it relates to the discussion earlier of, if we change this to a family leave policy, and Rob, I really like that wording. I think that's what we should be striving for here. Adding the state into the equation, I'm very concerned about getting bogged down there in having a second layer of the onion, if you will, of having to deal with that. I personally would not advocate for that. But secondarily, as you're talking about the expense and exposure to the county, in some of the correspondence that I read through this morning, the point that was, or that those that provided it attempted to drive home is the leave that would be extended to these, to anyone paid parental leave as we currently look at or otherwise, currently is capped at 12 weeks. And that 12 weeks, as far as what would be paid to the individual on this leave, really is underpinned by the salary. The single thing that you have to consider is the money that they would have been making in any given pay week is now not due to hours worked. It underpins the leave time. Where the exposure to the county comes is who performs the work in the absence of that individual, and that being paid at time and a half. That's what the county would ultimately need to think of from a financial perspective, is who picks up that. Can that work wait? Is it time sensitive? And that varies from department to department. So to be clear, as I see it, the financial expense is moving from what already exists in a salary line for any given employee to underpin the 12 weeks of leave. To me, that's kind of a wash. That's just moving it from one bank to another or one line to another in budgeting. But the exposure piece is who does the work, and is that paid out at time and a half? That I think is the ultimate question, and that's a finance question.
Thank you. I don't think I have anyone else on staff right now. So, Iris.
Yeah, I hear you. I think that's a good point, John, around the overtime for those that are, paid hourly. And that's probably going to be certain departments, maybe your department, you'll see that more than some of the others, for example. But I think on the flip side of that, and this is another comment we received, is to consider the turnover. I mean, I know so many people, self-included, right, who end up leaving a job because there just isn't enough leave to care for your family. And so then you have the cost of staffing up and replacing that person or many people. And so I think for retention, I think it's really crucial. I also think it's going to be great for recruitment. I think especially as we're looking at, a wave of sort of the baby boomer generation retiring and needing to attract more people to these positions, it's going to be very attractive to have 12 weeks of paid family leave. That's really valuable, like fully paid. That's hard to find. And I think it would be a real selling point for the county without us having to raise salaries to attract people.
And I will add, we talk about the importance of and challenges with recruitment and retention all the time here. So it's very relevant. Okay, I think that makes sense to go back to now the text of the resolution and bring up more, but it sounds like a couple things that I'm hearing people want to change are, one, this is focused just on parental leave, but there is it sounds like a general desire from the group to advocate for a broader caregiver leave unless it would significantly delay the implementation process. And then second, the first resolved here is saying that the legislature adopts the paid parental leave policy, and I don't think that language is appropriate yet without the policy coming along, but we could phrase that to direct staff to develop a policy that covers this, that, and the other. I'm not wordsmithing this right now, but I think those two changes I hear as being desired, and maybe there are others. I'm not proposing an amendment specifically at this moment, but I want to focus on that. John, I see your hand.
Yes. So just as far as the resolution is concerned, and this is really underpins why I asked it about the policy in the first place. In the resolution in line 1, I think if it read adoption of a paid parental leave policy would have been extraordinarily helpful when this resolution first came out. And then secondly, lines 44 and 45 of the resolution, I think, need to be deleted just for practicality's sake, because it's saying take effect immediately upon adoption. Those were kind of the two big things there. I'm open to further discussion on whether this needs to be recrafted into caregiver leave or family leave, however that needs to be wordsmithed. But those were the two big things as the resolution currently stands.
So the two things you brought up is adding the word "a" in the title as adoption of a paid parental leave policy, and just removing the second resolved on lines 44 and 45.
That is correct, yes.
That sounds like it has the potential to be friendly. Is it friendly to the mover and seconder, and is it unfriendly to anyone? No. All right, I think that is a friendly amendment included. Blech. Iris.
And I would propose amending every time we see the word parental, changing that to family. I guess we should decide, do we want it to be family leave or caregiver leave? It sounds like some people prefer family, some people prefer caregiver. So I guess that's a discussion we need to have. So maybe I won't make that full proposal. Yeah, I guess it would be helpful to decide what we would like, but I think we could easily amend it by just changing the word parental to whichever word we choose. And then lines 7 and 8, we say this leave is essential for fostering healthy families, supporting child development. So we could either cut child development specifically and just have it say that the paid leave is essential for fostering healthy families and ensuring equitable access to caregiving opportunities. And that could be, we could say for all forms of family, and then just leave it at that and cut basically line 8 so that we're not specifically saying birth, adoption, foster care placement. Or we could leave that but add in the other forms of caregiving. So that's another suggestion. And then at line 24, we talk about fully paid leave for eligible employees to care for and bond with a new child. We could just cut out to care for and bond with a new child, and that way it would be applicable to all caregiving situations. Or it could say to care for eligible family members. No. Irene says no.
Irene, go ahead.
Yeah, I just bristle at using the word family. because I think there are situations, I mean, it used to be legally, people like me as a lesbian, our families weren't considered families. I think there are any number of situations still where somebody may not be considered a family member, but a close friend that you're very involved with and, taking care of, or somebody's child, that just isn't in any sort of legal definition a family member. So I would like to see this be as broad as possible, and just caregiving for me
I think
works
that's
best.
great. We're just going to have to deal with the definition section of the policy, because the policy does have to have some bounds around who qualifies as the person that you're caring for to take the leave. And so usually there's a word, and usually it's family, and then they define that. And it sometimes has been defined more broadly than, family by birth or marriage, kind of. But that's a question that maybe for the folks on the policy committee.
Yeah, I will say that the specificity is useful. And having lived exactly the same issues as you, Irene, I know right where you're coming from, but also from a policy and a financial management point of view, where we have legal precedent for definitions of family, grandparent, parent, spouse, sibling, child, grandchild, and so forth, that are already well established in jurisprudence and do have some sort of guardrails as far as every situation that might come up. Don't get me wrong, I'd love to be able to supply to pay leave to somebody who, protected leave for somebody who, or bereavement even, for somebody whose best friend just died. But, the broader we make it, the harder it is to pay for it. So working within existing financial and definitional frameworks may make it easier and clearer for us to at least get this in place and look at what might be available further.
I'll remind everyone the words do matter, and also the details of the definition is something that will be worked out later in finalizing the policy and not right here and now. But thank you. John, and then Iris.
Yes, I would just offer this as a suggestion. Consider pointing in the direction of the already established bereavement leave policy at the county level that lists out all of those eligible family members, if you will. It's rather robust. I'm not going to say it's 100% because there may be things that I'm not considering from my perspective, but that language is already in place, and that may prove to be helpful to underpin this.
Thank you. Iris?
And for the state definition of family members, it includes spouse, domestic partner, it says including same and different gender couples, legal registration not required, child, stepchild, and anyone for whom you have legal custody, parent, step-parent, parent-in-law, grandparent, grandchild, and sibling. So that's how they define it at the state level. I'm not saying we have to use that, but it's somewhat more inclusive than just, your children and your spouse. But yeah, I think it is tricky to be both inclusive, but also have some boundaries so that, as Rob said, that it's not sort of bleeding into every scenario.
Rachel. Oh, go ahead. Sorry, Rachel O.
I would support either family or caregiver. I think if we want to have it be the kind of like the most inclusive, we could say caregiver, but still use the family definition that New York is using to define it. But the amendment that I would be proposing would be for the second to last resolve. I agree with John that we should take out the line 44 and 45.
Mm-hmm. Those are gone now.
Okay, those are gone.
Yeah.
And then, which would it be? On line 40, to say that the Tompkins County Legislature support the development of a caregiver or family leave policy instead of hereby adopts.
Okay, so you were making an amendment.
Yes.
Is there a second for that? Iris seconds. Is that friendly to everyone?
Change to caregiver.
No, that was discussed, but the amendment here is on line 40 to take out the words hereby adopts the and replace them with supports the development of a.
Correct.
Got it, okay, sorry.
Okay. Does anyone object to this just being included as friendly? Okay, seeing none, that is amended. Did you have more, Rachel?
I mean, I can make a motion to amend the wording to a paid caregiver leave policy.
Do you want to?
Or should there be a discussion about whether it's caregiver or family? I don't know the best way to kind of like make a decision and then move forward on that.
I would say move an amendment and then we can discuss.
Okay.
I guess my question is, do you want to replace the word parental with caregiver throughout?
Yes. Yeah, I mean, I feel like we should choose one word that we want to use instead of parental.
Yep.
And then replace it throughout the entire resolution.
Okay.
Yes, I'm making
Great.
an amendment. I'd
All
like
right.
to make an amendment.
Thank you. Is there a
Parental with caregiver.
Iris seconds. Discussion on that. Is it friendly? All right, there we go. We are such a friendly group. Thank you.
And did we already make Iris's changes as well?
No, we did not. So at this point, I think Iris, I forget everything you had mentioned. You had, but you had pointed to this like list of things parental leave is essential for in lines 6, 7, 8. It's now going to read, whereas Tompkins County recognizes that caregiver leave is essential for all these things.
Yeah.
Iris, did you want to move a specific amendment now?
Sure. So I will move that from lines 7 to 8, it will read supporting child development and ensuring equitable access to caregiving opportunities for all forms of, and then do we want to say caregiving? Or is that just too redundant?
No, I think family, I'm sorry.
You think, I'm curious what you think, Rachel, if you want.
I would say keep it as family building. I think it's
All forms of family building. I guess my concern there is not necessarily building to care for someone who's already in your family.
Part of me wants to say family building and maintenance, but that's like
Maintenance.
not a phrase that people use. Just a little tune-ups. Yeah, Irene?
Yeah, just how about just ending it after the word all, ensuring equitable access to caregiving opportunities for all.
Yeah, that sounds good. I like that. So line 7 would end at all, and then we'd strike the rest of that clause. And then I would move that for lines 23 to 24, it would say comprehensive paid caregiving leave policy, providing up to 12 weeks of fully paid leave for eligible caregiving.
or just for eligible employees.
Or for eligible employees, I guess we could just say that, okay, for eligible employees, and then just strike to care for and bond with a new child.
Okay, so is that so Iris, you are moving an amendment that includes basically the deletion of these two clauses.
Two clauses.
One in line 7 and 8 and one in line 24.
Yes, I think that's it.
Could you read how it
Okay,
reads
so
now?
line 7 will, or line, that whereas clause that starts on line 6 will read, whereas Tompkins County recognizes that caregiver leave is essential for fostering healthy families, supporting child development, and ensuring equitable access to caregiving opportunities for all, comma, and then line 22 through 24 would read, whereas a working group of county employees with internal stakeholders has developed a comprehensive paid caregiving leave policy, providing up to 12 weeks of fully paid leave for eligible employees, comma, and.
Thank you. We need a second for that amendment. Irene seconds, and I've got Rob and John.
Since we're specifying the 12 weeks, could we also please say 12 weeks, which may be contiguous or intermittent? Fairly useful to specify in these policies whether or not it has to be a block or if you can slice it up, and it is best for families to be able to choose whether or not they need to slice it up.
The draft policy does include that it is intermittent, can be intermittent. I'm worried about us getting too specific in the sort of charge to the committee, but it is in the draft right now.
Although BCP and legal are within their rights to fully revisit the entirety of the draft if they do, so the resolution is our opportunity to encourage specific terms. I mean, I'm not going to stand up and really insist on the additional clarifying language, but since we're already saying 12 weeks in our resolution, I thought I'd bring it up.
Is that an amendment to the amendment?
I was going in that direction, although I hadn't formally phrased it that way.
Well, now I'm asking you to choose.
I'm choosing. Since this resolution is our language encouraging the rest of the legislature and other committees, I would like to have that in there, seeing as the draft policy document itself is great, but we are not specifically recommending the exact text, knowing that it will be edited.
All right. Is there a second to that amendment, to Iris's amendment?
Well, it's re-amended.
So I haven't done my Robert's Rules calisthenics in a while, so I'm excited. So this resolution with its like 3 or so friendly amendments is on the table. And then that's the main motion. Iris has proposed an amendment to remove those 2 clauses. We are discussing the amendment.
But with Rob's.
And now Rob is proposing amending the amendment so that in addition to the removal of those 2 clauses, it would also add in the phrase, can you say it again? You have 12 weeks.
Which may be contiguous or intermittent.
Okay, which may be contiguous or intermittent, comma, a fully paid leave, blah, blah. And did someone second the amendment to the amendment? Rachel G. did. Great. So now we are discussing the proposed amendment to the amendment, if any discussion. Further discussion. Yeah. John, did you want to speak on Rob's amendment to the amendment? Okay.
I would say one quick thing.
Yes.
Thanks for that, Rob. I will just say that the working group did talk about that extensively, that we did feel that it is important for families to decide what works best for them. So that is why that language is in the draft policy. And I agree with you, if this is our statement to encourage support for that, that it makes sense to have that here as well.
Iris, do you have something?
If we're concerned about other things getting taken, then there's other parts of the policy that I wonder, do we want to put it in here? And so that's where I'm worried about where we cross the line of being too prescriptive. Because I think another piece that's important that I noticed in this policy that is unusual for many employment policies is that the leave is separate from and in addition to accrued paid time off, and may be taken concurrently with FMLA or other job protected leave, essentially not requiring employees to use their accrued PTO before tapping into this, that this is a fully separate bank. That is not always how employers run their policies, and so my concern is if we think that we must specify that intermittent or blocks needs to be put in the resolution, that this may also be another piece we would, if we feel strongly about it, that we might want to put in the resolution.
That looks like it might be what the whereas in lines 32 to 34 is saying. Is it?
No. Well, oh yeah, it's separate from and in addition to. Existing accrued leave time. Yeah, I guess that should do it then, sorry.
No, that's great. Okay, are amendments to amendments eligible for friendliness? Okay, is Rob's amendment to Iris's amendment, just adding this, which may be continuous or intermittent, is that friendly to everybody? Yeah, he had something for something other than this.
And
Okay.
I would put it after the word leave, I think, up to 12 weeks of fully paid leave, comma, which may be contiguous or intermittent, comma, for eligible employees. Does that make sense
Okay.
as a where to?
That makes sense, seeing a
Locate it.
thumbs up from Rob.
Okay.
Great. Okay, so Iris's proposed amendment has now been itself amendment, so what's on the table is amending this resolution to, again, delete that clause in line 7 and 8, delete that clause in line 24, and add this phrase about continuous or intermittent in line 23. John?
Yes, so not to now have an amendment to the amendment to the amendment.
Well, that's not allowed, but luckily we only have one layer of amendment, so you can amend it again.
Okay. In line 15 and 16, I do not frankly know enough about the Federal Employee Paid Leave Act, but in line 16, it goes and it says 12 weeks of paid parental leave for eligible federal employees, and conspicuously the word fully is missing from line 16. If they do not fully pay for that 12 weeks of parental leave, then I am going to suggest ending that whereas after resolution number 119 and deleting the remaining lines.
Okay, I'm going to also note that in line 16, if we include it, it has the word parental, which might now say caregiver, and I don't know what is accurate about the Federal Employee Paid Leave Act. And I'm going to hope that Rachel G. or Matt or someone can enlighten us.
Sorry, I went to the bathroom
Yes.
and missed something.
The question is in lines 15 and 16. In addition, it says, in addition, the federal government under the Federal Employee Paid Leave Act provides up to 12 weeks of paid parental leave for eligible federal employees. John notes that it doesn't say it's fully paid and wonders if true, if we should specify that it's fully paid, or if it is not fully paid, should we just take out that whole sentence? And then
I don't remember whether it is or not fully paid.
I don't recall. I'd have to look at the text.
I'll look it up.
all right, so John, given that, what are you moving, if anything?
Just that correction, that if the word fully is missing by, not intentional omission, then put the word fully there and then it can stay as is. But if it's not, I don't think it's relative to what we're asking, and then it serves no purpose in the resolution, and delete those last two lines.
Since that depends on some information we don't have at this exact moment, can I ask that you hold that change for its own amendment?
Sure.
Separate from Iris's? Okay, thank you.
Yes.
Any more discussion on what I'm calling Iris's amendment?
Oh, wait, sorry.
Yeah.
On line 23, I think you guys said caregiving, but I think it should still be caregiver. Right, so we're using caregiver leave. Just using the same word all the way through.
Oh,
That would be, so I
Yes,
think.
good point.
Just when Iris read it out loud, so that would be my change.
okay,
I
caregiver.
said caregiver.
All right. Is this amended amendment friendly? Or do we need to vote on? No.
You were back on the original amendment. You said that the amendment to the amendment was friendly.
Yeah.
You're back to the original amendment, so is the amendment friendly? Are all the changes we've made so far, excluding John until we have the information, has everything seemed friendly to the whole group? Perfect.
Okay, great. So those changes are made also.
I think it is, yeah.
So those two clauses are gone. That clause about continuous or intermittent is added. Is there any chance someone has very quickly learned about the Federal Employee Paid Leave Act? And, yeah.
Reading off of the U.S. Office of Personnel Management, key features, and now I lost it. Essentially, it is fully paid.
Sorry, what?
It is fully paid.
Okay, it is fully paid, great.
Yes.
While you have it, is it just parental leave or is it broader than that?
This is the PPL, the Paid Parental Leave Policy.
Okay. Irene?
Yeah, I have similar questions about whatever they passed in Ulster County and whether that is parental or caregiver.
Parental.
So maybe within this whereas clause that starts on line 13, we should use the word parental and not caregiver.
That makes sense, thank you. I'm hearing a proposed amendment for the whereas starting on line 13, all of the words that were parental, and we changed to caregiver, put them back to parental and just that whereas. Is that friendly to everyone? All right. Jordan, did you get that?
In all of the whereas that begins on line 13,
Yeah,
none of them will change. They will continue to be parental.
yes, exactly. And so then do we also want to add, since Matt, you said the federal one is fully paid parental leave, then do you want to add the word fully on line 16, so it's 12 weeks of fully paid parental leave? Seeing nod from John, thumbs up, nods. Is that friendly to everyone? All right, we'll make that change as well. Any more amendments or discussion? Are we ready to vote on this resolution? Seeing some nods, hearing no objections.
I was not ready.
Okay, let us have a roll call vote. Jordan, do you want to call it? Okay.
Robert Brown.
Yes. Have fun, BCP.
What is it?
Jennifer Micah.
Yes.
Rachel Graham.
Yes.
John Halachek.
Yes.
Veronica Pillar.
Yes.
Samantha Almendinger.
Yes.
Iris Packman.
Yes.
Nicholas Bennett.
Yes.
Irene Weiser.
Yes.
Rachel Osland.
Yes.
Veronica.
I think I already went, yeah.
Did they?
Yeah, no, I voted.
Oh,
We all
okay.
voted,
I missed
yes.
it.
Sorry. Amazing, that passes unanimously. Thank you. The Budget, Capital, and Personnel Committee meets on the second Monday at 10 a.m.
Are any of you on?
Both Veronica
Irene and I are both on it.
and Veronica is vice chair.
This is true.
Yeah.
All right. Thank you all.
Thank you.
Where are we?
I have a question.
Yes.
So now that we've redrafted this, it's going to BCP and BCP has to send it to the full legislature?
Yes.
Okay.
I don't know that, I don't know if it automatically goes on the next BCP agenda, or I suppose anyone can decide to postpone it into the future. But what does not happen is resolutions coming straight from WDIC to the full legislature. Any resolution from WDIC has to go to BCP first and get approved there before going on to the full legislature.
So can we get this on the agenda for the next BCP meeting? Is there enough time?
There is enough
Okay.
time, yeah.
You said it's the second
Monday.
Monday.
So next one's March 9th.
And so we talked about that there's this resolution and then there's also the actual policy. So who refines the policy to now be caregiver leave instead of FAM?
So the county has an established policy about policy development, which says that, we'll see if I can paraphrase without messing up. For proposing new county policy, the responsible department will draft new or revised policy language. So I suppose in this case it would be HR, and I would imagine, and admin's also part of it. This says the responsible department will draft new or revised policy language and submit it to county administration for review. So having the draft policy from the working group is not like part of this process, but of course I would, ask HR to start with that and go from there. And then county administration will review the document, make edits as necessary, and send the document to all department heads and members of the legislature for further review with a deadline to submit revisions. County admin will prepare a final draft based on feedback received and share it with the responsible department. County admin, in coordination with the responsible department, will bring the final draft for formal vote and approval before the relevant program committees, the Government Operations Committee, and the full legislature. So basically, there'll be an editing process with HR and county admin and legislators informally, and I think it can happen with WGIC members informally, and then the policy will come back here and go to BCP, and also go to government operations, and go to the full legislature. Yes.
Given that long journey it's going to take, is it ever appropriate for us to put together sort of a memo packet of like, here's why we think this is really important, maybe pull some excerpts of comments we've gotten from staff about why it's important, and then put the draft of the policy that was already worked, kind of like make a nice package so that it doesn't get lost in translation as it goes to all these different groups?
I think that's a great idea. And don't see why that would.
Although our resolutions go through BCP, our committee also does have precedent that when we feel strongly enough that we want our words exactly to reach the full ledge, we have periodically sent letters that were independently written and co-signed by members of the committee rather than forming our conjunct opinions as a resolution. So that's just one of the procedural things for things like putting together a packet like you described.
That's true. We did this as recently as a few months ago.
Well, I'd be happy to work on that. I would love it if anyone else wants to be a part. We could sort of put together a little subgroup if anyone else is interested. Yes. Okay, awesome.
Yeah, I would be.
Great. Okay, so it looks like we've got Rachel G. and Samantha. Anyone else online? Okay, well, it'll be the three of us for now then. Right. Thanks.
Yeah. Thank you, all of you, and thanks for taking the lead on that, Iris. Anything else on this policy topic? Great. So our remaining main thing is to discuss Workforce Diversity and Inclusion Advisory Committee goals for this year. And I sent out just yesterday a possible draft of goals collected from just previous discussions in committee and with committee members. And I don't know, and I know some people have some other suggestions. Would you want to review the list I sent out first? I could just read briefly what the items are and then open it up for questions, changes, addition.
Sounds good.
All right, no one's telling me it's a terrible idea. Great, thank you. I sort of vaguely sorted these into 4 categories. One about ongoing processes, the Leslie McBean Claiborne Strength and Diversity Award, to award that again, and that we can establish a working group for that, like we did last year, continue and improve the process we cobbled together last year and award it again. 2, onboarding and membership, update or refine the onboarding packet, ensure all members are familiar with it. Lots of us have been here longer than the packet, which Rachel Graham pretty much independently made. And then fill, thanks Matt, and fill final vacancies, there's only 1 remaining for the committee. And then 3, the Heritage Months, this committee, maybe informally, tends to have the responsibility for bringing forth proclamations for things like Black History Month and Pride Month and such. And we, by which I maybe mean I, am have a pattern of waiting until beyond the last minute to figure these things out. So a goal that at least I have, we've got a calendar of Heritage Months that it's in the meeting portal, meeting documents somewhere. I can send it out again, but to expand this into a clear list for the year of deadlines when the various tasks need to be done by. And those are things that would ideally, these would just be recurring into the future. Few goals about committee structure. Clarifying and updating the name. Sometimes the word advisory is in there, sometimes it's not. There was a question of should we have the word equity in here, because it is just the Workforce Diversity and Inclusion Committee. Equity was not as much a term, workplace term talked about a ton 20 years ago when this committee was founded, but it certainly is now. Thinking about the system and structure of WDIC reporting, someone pointed out that we have this official connection to BCP, is that the pathway to the full legislature from WDIC is through BCP. There's nothing formally saying that WDIC and BCP have to have any overlapping members, although I think it is good to. And it came up that a lot of topics of interest at WDIC also overlap with the Health and Human Services Committee, and there's no formal relationship there, but maybe there should be. We can think about that. And finally, clarifying WDIC's relationship with open meetings law, which we almost, but not fully, already follow, just like any legislature committee does. Third cluster is CEDO, Chief Equity and Diversity Officer centered work. Helping onboard the new CEDO is a part of it. I know the JEDI co-chairs have thought a lot about that, and one of the previous person in that role, one of their suggestions going into the future was make sure the new person starts with understands that there is a lot of infrastructure and process and institutional knowledge existing already, and have them start there. Website management, we have a WDIC page on the website that is a bit out of date and could be brighter. Equity indicators, hearing from and supporting departments with that. Part of the policy around department equity indicators was that they are supposed to share their indicators and how it's going in some form with WDIC. These were a new thing last year, so we've heard from a few departments last year about their indicators, but not from most of them yet. So I think figuring out how we can touch base with the departments, support them, not seem like this committee is there to I don't know, judge or criticize, and also to provide a not cumbersome process that works well for both department heads and this committee to overall, support the increasing embedding of equity in our organization. I put this in the CEDO-centered work category because through the whole equity indicator development, the CEDO was like the main interface between WDIC and department heads around this. And finally, scope of workforce DEI work. There was desire in terms of the overall work the CEDO does to expand it, clarify exactly what that means, and specifically increase work, do more around LGBTQ plus community issues. And then finally, just current topical issues, the paid, well, I wrote paid parental leave, paid caregiver leave. Obviously, getting that to the finish line is a goal. And we did some good work on this just now. Retention and recognition of employees in general, obviously that's something HR already works a lot. I don't mean to be staring at Samantha. But it came up that there's lots of best practices and scholarship around that are not necessarily included in our organization's policy or practice, and not necessarily for any terrible reason, just things change over time. So learning more about that to start with. The Office of Human Rights status, there was a desire for this committee to stay updated on that and make sure there's a public engagement piece in where that goes. The climate survey, shepherding that process, working ideally closely with county administration, which will be running the climate survey, ensure that it happens this year. I don't know if that is something a working group would make sense for, or, I mean, a conversation with administration for sure. Monitoring progress with New York State civil service reform. This came up when HR was presenting their equity indicators in December, and Larry Workman shared that there was, and I don't know, Sam, expand on this if you want, that there was some major changes, probably for the good, coming down the pipe from the state. And I don't know that this committee will necessarily have anything to do about it, but we wanted to stay updated and go from there. There may be no news until like halfway through the year.
Yeah, that's my guess, is from what I'm understanding and hearing from others in HR, it's probably like summertime where we'll hear more about that.
Awesome, thank you. And finally, acknowledging the prevalence of single individual households, whether young or old people, or of any age, not just single elders, and including them in discussions and decisions around households and families, because I should say, I'm one, often get left out. And then Irene, you already shared.
Yeah, I added one more.
Yes.
To the list of new topics.
Right. Yeah, Irene, could you share that out, and then I'll open the floor.
Sure. And Sam, apologies to calling this HR tapes when we onboard mind numbing, but in going through those tapes, I did come across something that actually piqued my interest, and it said that in New York City, the following are also considered protected class in the workplace: pregnancy, childbirth, related conditions, sexual and reproductive health decisions, height, weight, immigration or citizenship status, partnership status, caregiver status, status as a victim of sexual offenses or stalking, and whether we want to consider adding these as protected areas as well, and possibly others that we might think of, whether it's fat shaming or, whatever, all kinds of stuff that goes on about some of these other dimensions of people's individuality that I think should be protected as well.
Awesome. Thank you. I like that.
Offense taken on the tapes. Some of them are.
What?
I said no offense taken on the videos.
Yeah. But so, and there probably is a model to follow because it mentioned that it was in New York City. So I'd be willing to go look up the statute or whatever they have there.
I think some of these are county protected. I don't know if all, but
Okay.
I think some of them.
Okay.
Yeah.
And just we might have a more broader discussion of other things that we might want to see.
Yeah. That could be a good goal
I-
to look into what is protected and consider.
Consider
changing it.
other.
Yeah. Consider expanding it, for sure, not contracting. Rob?
Thank you first, Veronica, for your work on drafting these up. I think that it's a very good framework, and thank you again. I have another potential addition to at least suggest, understanding that there's a huge number of moving pieces there. I think it would be reasonable for this committee to have discussions about the minimum wage study being conducted independently on county contract, simply because, data show that we are the fifth most income unequal municipal statistical area in the entire catchment of the New York Federal Reserve, which is really not a feather in our cap as a community. And data also show that the income inequality is strongly correlated with race and ethnicity in particular in our area. And so while there are many other chaining decisions related to that study, I think it would be useful to have on our discussion docket at minimum.
Noted, thank you. You reminded me, I wanted to potentially add one. I know I drafted this list, but I don't know if it came up in discussion, which about the county's status as a living wage employer and having a policy or not, do we want to, about paying a living wage to our own employees, which historically the county has done, but I don't believe there is anything that forces us to continue doing it. And in fact, I believe we are not continuing to do it at this very moment in time.
We were the first living wage certified municipality in the U.S., and unless I completely missed it, there is not a policy.
So that's another possible thing. Sam?
Yeah, I have another one to add. So I co-facilitate a employee committee as well called the Employee Engagement Committee. And part of our focus, well, a huge part of our focus is retention. And something that we're currently doing, and you may have seen the emails about, and it's also been sponsored in the newsletter, our committee, and there's a couple members of our committee here too, Chris and John. So we are currently conducting a workforce wellness survey to guide our committee's work. But I think a connection to WDIC in the focus of workforce wellness in terms of mental health, emotional health, would be really great. I'd love to see that.
Awesome, I like that. I want to add in at the Budget, Capital, and Personnel Committee this month, when we were talking about committee goals there, one of the suggestions raised by legislator Christy Bianconi, who Irene is not, but she usually sits in this chair, was to look at employee burnout, and especially in general, and especially around employees in care providing crisis response type roles, because that is a big issue, and one that I think ideas on how to support employees are ahead of actual resources we have to support employees at the moment. I have lost track of, John and then Iris.
The only thing that I would add, and perhaps it's related to item 5 under committee structure, which is liaising with Health and Human Services, is just, I think it would be a worthwhile endeavor for this committee to have some type of discussion about healthcare in general, and specifically through the lens of equity and inclusivity. I think that's important work that needs to be done. This year, I think, would be an excellent year to do that and continue to do so in subsequent years. But something that I think this committee should bear in mind is next year will be a contract negotiation year of the white collar contract, which is the largest subsection of county employees. And I think there are certain things that this committee needs to think about in advance of that as well.
Awesome, thank you. I wrote down Irene, but I think I meant Iris. Okay, Iris, and then Jen.
As you're talking about employee burnout, and I'm thinking, if we're about to have 12 weeks of paid caregiver leave, do we have equivalent leave if you have your own medical issue, fully paid? Okay.
Yeah, it depends on the bargaining unit. And so white collar has a certain number of hours. That's, I can't remember how many and how much that equates to. But that's fully paid for disability time. And the other ones are, some of them are sick leave, and yeah, they're slightly different depending on bargaining unit.
It would be interesting, maybe HR has already compiled this, if we could just see what that looks like too. Because I certainly think, it's important to have caregiver leave, but also if employees need to be able to take that leave, and if they aren't able to get 12 weeks fully paid, then that's another issue I think we should be very much looking at.
That is a great idea. Jen, did you have something?
Yeah, I have a question related to what was brought up earlier about the engagement committee, and then point number 12, Veronica, that you had listed retention and recognition. And I'm curious if there is a responsibility that this committee has towards improving culture, workplace culture. Is that part of our scope?
I think it's within our scope. What I want to do is look up at our bylaws and quote chapter and verse, but I don't have them in front of me. But I mean, yes, I think that's highly related to, certainly inclusion is part of culture, comes from culture. They're inextricably intertwined.
And then who's responsible for kind of implementing those types of recommendations? Is that the CEDO? Is that HR? Is it?
I think, Sam, and then I'll go.
I think that depends on what the recommendation is. I think it could be the CEDO, it could be county administration, it could be HR, it could be all departments, depending on what it is, yeah.
I think county administration, and certainly the county administrator, perhaps taking recommendations from wherever, has a lot of both the responsibility and influence to influence workplace culture organization-wide. And then, anything can happen in different program units or whatnot. I think, although I'd really rather hear from non-legislators on this, that the legislature also influences workplace culture a significant amount. And we don't take direction from nobody, which is maybe not great and a thing to discuss.
And then just a quick follow-up to that is for the climate survey, is there any type of mechanism to communicate, the results of the survey and what is being done to address it?
Sam?
I mean, I don't work for the county, so I don't, I'm kind of in the dark about it, but I'm just curious. Go ahead, Sam.
Yeah, I can speak to it, and probably Rachel too. Just based on the last climate survey that was done in 2018, there was a lot of focus from county administration put on informing all employees about the results, and individual departments even got their results and were required to share those with employees and talk about them, formulate goals to make improvements. And then there was also the formation of countywide groups, which JEDI stemmed from, and also the current, what we're calling the County Engagement Committee. It was a longer name when it was first formed. It was like onboarding, retention, and engagement. We've kind of shortened it to encompass it all. But those two committees are still standing from that, and we share what we're doing with employees.
Thank you. Anything else about goals?
So there's a lot of them. They all sound really important, and that's great. And I hear you that some of them aren't going to be a real heavy lift, but we just need to work on it. But where do we go from here? Do we assign people to them, or how do we actually implement these goals?
So I would suggest I can this afternoon send out the potential goals list again, but with everything people have shared added on. And then I would love to hear from all the committee members, maybe if you could just reply to me with, of these goals, which few, like 2 to 5, you think should be top priorities, and it doesn't have to be the same, which ones you personally are interested in working on, especially if there's anything that you think, I want to spend some energy on this outside of the committee meetings. And maybe let's say that the paid caregiver/family/parental leave is, I think, clearly a high priority. So you don't have to tell me that that one should be a high priority. Let's just automatically put that in.
So I'm thinking maybe a little bit of a different kind of organization. I'm not opposed to us saying which ones we want to, we think are most important or that we want to work on. But I wonder, first of all, if like a Survey Monkey that allows you to rank things, would just make it easier than each of us emailing you about that. But also, I think maybe rating them as to ease of implementation could be helpful as well, and whether you can rank that or whether you want us to, so Survey Monkey allows you to just pick, to rank choice, and you have to pick every single one and put it in, your number order. But anyhow,
yeah.
Being able to look at ease or difficulty of implementation, because there's a lot that we could probably knock off as easy things to get done, and others that are going to take some digging in.
Right. Sure, I can make a Survey Monkey. I think, we can chat a little bit more, Irene, if you want, after the meeting. We have 1 minute left in official time. Is there anything more people want to say about goals out loud right now? Okay. Moving on then, do we have any committee members' reports? put anything. Wonderful. Could I have a unnecessary motion to adjourn? Rachel O. moves. Irene seconds. All in favor, raise your hands. This is a fake vote. All right, we are adjourned unanimously. Thank you all.